we sent a very general handout around so you have some exposure to the program. Anybody here attended a cavity-free at 3 training? I love this side of the room. When we were going around, I'm like, oh, we train them, we train them, we train them, we train them. So I should probably stay on this side of the room, right? Because you guys could help me do this. But a little bit about myself. I really want you to know that I am a dental hygienist. I practiced dental hygiene for 35 years. My job before I came to the University of Colorado was with Children's Hospital Colorado. I was the clinical coordinator for the dental service, so I worked in the operating room for 7 years, all day, every day, accommodating pediatric dental providers that were bringing children to the OR for general anesthesia to have their teeth restored. I measured my success every year. I did a bang-up job. I'm here to tell you, I got awards and recognitions and lots of pay increases because I was driving the number of cases up. When I first went to Children's, we did 1,300 cases a year. My last year I was there, we did 3,000 cases a year, and I thought I was doing a great job. I just thought I was on top of the world. One day I had an aha moment, and I thought, why are these children coming back again and again and again and again? I started to know the families. I would recognize the children. I'd say, oh, you're getting big. That is not how you measure success in dentistry. So I had this aha moment thinking, why are we not educating these parents how they can keep their children out of the OR? The consequences are so grave to these young children. 80% of the children that we saw there were Medicaid children. So I thought, we have to have some type of educational program. About that time in 2007, Cavity Free at 3 was being born. Other people were paying attention to the increasing decay rates in this state. So we developed this program to try to educate primary care providers, because we know these children and these families are seeing you as medical providers sooner in life and more frequently than they were seeing dental providers. So that really started the success of Cavity Free at 3. I'm very happy to tell you that I now measure my success by the number of providers I train. And I've been teasing people along that I'm going to retire once the decay rates in Colorado are seen to be decreasing. And just recently, in the 1st of October of this year, we actually have that data that decay rates are down. So I've been threatening to dance on the table. I won't do it tonight. I will spare you that. But that's a little bit about where I came from. So I'm very passionate about having children have access to care. Whatever that needs to look like, we need to be educating the parent so that they know that this is the number one, Steve, thank you for the correction, chronic disease in children is tooth decay. You see it every day. You see it all day, every day. So I want to share a little bit of success story about Cavity Free at 3. My little shining star is Rocky Mountain Youth. We trained Rocky Mountain Youth in April of 2011. And now, since we have had so many medical providers billing for these dental codes, and I'll speak to that in just a moment about how you do that, but we have so many medical providers delivering these services, Medicaid actually runs a Cavity Free at 3 report. So I can know exactly how many dental services are delivered as part of a well-child visit. That's incredible. So when you build this in your office, you're probably, the people that I have in here in front of me are probably not aware of how that's done, but you bill a code with a D in front of it. So it means a dental code. We have our own CPT codes in dentistry, and they all start with a D. So when we look at Medicaid data, I can very easily pull the number of D codes provided in a medical setting. And Rocky Mountain Youth, in 5 quarters, so they started the last quarter of April, they started in April 2011, they started billing services the last quarter of 2011. So this data runs for 5 quarters, so 1 full year and another quarter. In that time, they billed 3,035 fluoride varnish and educational opportunities. The compensation for that is $45 per encounter. There are some restrictions to it, but $45 per encounter. So they've generated an additional $136,578 through their well-child visits that they're already doing. That's pretty impressive. We love that type of support. That's what we need. We need massive amounts of children to be seen for oral health. So I want to tell you a little bit about Cavity Free at 3. I love our new website. If you haven't been here, I encourage you to look. There are tons of resources here for you, how you get trained. All of our educational materials are here. Everything that we have in paper form is posted on the website. I'm a firm believer in less paper, more electronics. You can access any form that I'm going to refer to tonight on this website. So want to be trained in cavity-free at 3. It's the right thing to do for your families. I know I don't. Steve did a great job. I like the solution part. Cavity-free at 3 is the solution to something now rather than the cause. So if you want to be trained in the cavity-free at 3, you fill out an application online. You have your office staff give us the name of someone that we can coordinate that with. We have a standard 4-hour presentation. I know that is somewhat cumbersome, and I don't expect practices or clinics to shut down their production for 4 hours. So you really have 2 options. We have 4-hour presentations that we try to coordinate within communities. So we try to gather providers of different disciplines. Anyone is welcome. People ask me frequently, who can come to a cavity-free at 3 training? I say anyone who's willing to listen, because we all have a role and we all have a responsibility in reducing decay rates. So you can come, or you can send your staff to a 3-hour presentation. You're going to get the whole show. You're going to get a presentation on child oral health, a perinatal component, and then we have a dental-specific module. So we're really targeting dental providers. You come in, you get that, you get a little certification, you get a nice certificate from us. We record that you've attended Cavity-Free at 3 training with healthcare policy and finance, so then you're able to bill for those services. When the policy changed and the Medicaid people thought that now we're going to allow this to be a billable service in Colorado, the only parameter they put on that is that you as providers, as medical providers, have some type of instruction. So we don't expect you to go in there. It's not rocket science. You can look at teeth. But we actually show you the difference between a white spot lesion and a full-blown dental caries experience, I guess. So a full-blown cavity as opposed to a white spot lesion, and your role in when you can change that, and when does that child really need to go to the dental provider. I got a question today, I got a phone call today. Aren't the dentists mad that the doctors are doing all these services? They're thrilled, because by the time they get that child's already had the seed planted about good oral health, the parent's been given some instruction, so it's a win-win situation for everyone. In Colorado, I am ashamed to admit this, but in Colorado, we know that 96%, Steve, is that correct, of pediatric providers accept Medicaid? A pretty high number, pretty high. We have 1,600 licensed dentists in the state of Colorado, and only 300 take Medicaid. So one of the questions that I know I'll get at the end, so I'll go ahead and answer that now, is I'm seeing these children, I'm providing this care, I'm identifying disease, but there's no dental provider to accept them, correct? Everybody here know what I'm talking about? So Cavity-Free at 3 recently got refunded to try to increase the number of dental providers that accept Medicaid, and increase the number of dental providers that are seeing children at the age-appropriate time of 12 months, which is what we recommend for their first dental visit. Steve's been instrumental in helping us get the fire going with that, because he's been so successful on the medical side. We want to replicate that. We want to figure out how that's done and how we can entice our providers to do that same level of commitment to these children. So you have the 4-hour training. If that's a prohibiting factor for you, you can complete some online modules. So you can actually go through the Society of Teachers of Family Medicine to the Smiles for Life modules. And if your providers will complete that, all licensed providers must complete the online modules. It's only 2 modules, and they're 20 minutes apiece. It talks about child oral health and fluoride varnish. So if you complete those modules online, Cavity-Free at 3 is more than happy to come out for a noontime presentation, provide the Colorado-specific information, our Colorado-specific brochures, and our billing information, so that you can bill Medicaid and receive compensation for it. Medicaid is going to require that you do one or the other. Questions? Either alive or the online modules. We're trying to make it as easy as we can.
When you say all providers, are you talking all providers who will be referring and doing that service, or all providers?
Anyone who's willing to listen. Okay. Anyone who's willing to listen. The billing arrangements with Medicaids, I know a lot of times you have a rendering provider, and then someone help me, some of these people from the back. You have a rendering provider, but any provider that's delivering the care, I say any licensed provider, you can get CE credits through that. So any licensed medical provider is expected to complete those online modules. How I see Cavity-Free at 3 work successfully in a practice is that the provider, as part of a well-child visit, you have to be able to deliver these codes in conjunction with the well-child visit. So you can't schedule a child to come in for a dental exam or a dental screening and provide those services and get compensation. That has to be incorporated into a well-child visit. So the diagnosis code V72.0, 72.2, someone help me. I can give you the dental codes. I don't know the medical code. 72.2? I was close. So the patient comes in. Well, how I see this most successfully implemented is when the provider does the anticipatory guidance. They talk to the parent. This shouldn't take a lot more of your time. You're already talking about safety, and hopefully you're talking about oral health. We're going to probably help you with some handouts that parents can take home that talk about things such as putting the baby to bed with a bottle, high carbohydrate diets, drinking tap water, brushing with fluoridated toothpaste. The American Dental Association, as well as Cavity Free at 3, the American Academy of Pediatric Dentistry, we recommend fluoridated toothpaste from the beginning, as long as it's an appropriate amount. Does that surprise anyone? So these are things that you're already saying. These are things that you're already talking about, hopefully, as part of your anticipatory guidance. You can deliver these services from the eruption of the first tooth until the day before the 5th birthday, so up until the child is the age of 5. At that point, we're hoping that the child has an established dental home. So you're going to give the anticipatory guidance, and very often we see the medical assistants applying the fluoride varnish. So as long as it's done under the supervision of the rendering provider, that's certainly acceptable. Questions about that? Anybody can share that that's working in their practice? It works. It works. So Cavity Free at 3, since its inception, we have trained over 1,900 providers in Colorado. 1,900, that's a high number. We've had 128 presentations, and we have 81 identified master trainers strategically placed throughout Colorado. We're in the metro area. We have no shortage of providers in the metro area. So we really target our efforts at rural populations where access to care is a greater problem. So we have identified 81 master trainers. They've all attended a 2-day, 4 hours is bad enough, a 2-day oral health symposium on how to implement Cavity Free at 3, and they go out and do presentations on our behalf. The cost to you is absolutely nothing. We are grant funded. We are an unusual project in that we are funded by all of the major foundations in Colorado that fund oral health, and I would spit them out, but if I left one out, I'd feel terrible. So all of the foundations that you hear about, they all put in money and they fund Cavity Free at 3. So there's no charge to you. All of our brochures, all of our risk assessment forms, our self-management goal sheets, our child oral health brochures, our perinatal brochures, all available free for the taking on the website. Nothing is copyrighted. We've got a lot of national attention regarding our program because we've been doing great things in Colorado. I know you've all heard a lot of negative press as far as, I get them all the time. My friends seem to love to send me the link to the nightly news and the negative reports about children dying and having terrible outcomes and things like this. But I get those all the time, and I'm one to tell them, we're doing good things in Colorado. We are doing good things. We estimate our outreach to children at over 50,000 children that have received Cavity Free at 3 services since its inception. And how we measure that, we distribute these Cavity Free at 3 kits. We work through Bayard Enterprises, and they distribute these kits for us. This has all of the tools, everything that you need to do a Cavity Free at 3 visit. The cost of this kit is $6. The compensation that you receive for the services is $45. So we measure how many children have a Cavity Free at 3 visit by the consumption of these kits. And we know that over 40,000 kits have been distributed to many of your practices since Cavity Free at 3's inception. Questions?
Do they have to use their kit?
You don't have, this is my sidekick, Anita. She's got all the questions and I have all the answers. We practiced. We rehearsed. The kit is not a requirement. You can purchase fluoride varnish independently. If you buy in bulk, you can get that down to about $1 a dose. I like the kit because it has a toothbrush for the mother or the primary caregiver, and it has a toothbrush for the child. When I do a cavity-free at 3 visit, I always dry brush the teeth because fluoride varnish will adhere to clean teeth better than teeth that have Cheetos and whatever else they've eaten on their way in. Cheerios, a lot of Cheetos and a lot of Oreos, which also gives me an opportunity to speak to the parent. But you're not required to purchase the kit. It's just a convenience. You can buy fluoride varnish, as I said, in bulk. If you buy it over 500 doses, you can get it down to under $1 a dose.
And we've had some practices who have worked with the dentists in their area and bought toothbrushes in bulk and little toothpaste in bulk and just put together their own kits. So that's possible too, in a Ziploc bag.
In Bayard now, we have encouraged Bayard. I get a lot of calls about how to get fluoride varnish. Fluoride varnish is a prescription item. It is a prescription item. So Bayard now will sell just the fluoride varnish to the tune of $1 a dose. So they buy in bulk and pass that cost saving on to Cavity-Free at 3 customers. Questions? Anybody have a Cavity-Free at 3 lovely story to share about how they had this family and now they're all so much better and they're all happy and they're not going to the OR, right? That's enough of a success story for me. So again, continuing education credits are available from the Smiles for Life. I believe it's 1 credit. It's all linked to the website. Patty Braun. How many people? I am president of the Patty Braun fan club, so I met with Patty today. Patty is conducting the evaluation component of Cavity-Free at 3, so she has all of the studies going. That is funded independently by the same foundations that fund Cavity-Free at 3. But she's really measuring decay rates in her population at Denver Health prior to intervention by Cavity-Free at 3 and post. So we're looking for decreasing decay rates there. And hopefully that will bring more attention and credibility to our program if we can show that it works. It does work. What other questions do you have, Anita?
What we've done, what CCHAP is doing now, as Steve mentioned, the best practices on the back. Oh yes, ma'am, you need to come this way. Thank you. You kept going over your blue line. Gotta be in the picture. We are working with Cavity-Free and have worked with about 15 to 19 practices. We surveyed them, we interviewed them in an attempt to find out how to make Cavity-Free work for you as a best practice. And what we've developed is this lovely, my Vanna White, best practice implementation guide. We are working with Cavity-Free, and if practices need some support in figuring out how to make this work within your practice, we started out by looking at, do you have a champion? Because we know that that's the best way to get it to work. Is there somebody within your practice who's really into teeth and really into having this process happen? It includes how do you include your entire staff, and also develops a quality improvement component so you can check it out and make sure that what you're doing when you do your well visits, that you're getting all of those Cavity-Free visits done at the same time. It's a really handy, easy sort of implementation guide. You can fill in the blanks, and if you fill in the blanks, you'll get there. And it has resources, it has a quality improvement. For those of you who like, you know, those old process flows, we got those. We tried to meet everybody's need. Job descriptions for people, if you're into job descriptions, and also QI formats so that you can easily write out the QI that you need to have for your process so that you can follow it. It also includes the provider bulletin that came out from Medicaid that tells you how to code and how to bill for the service so you get paid, which is always a really good thing. One of the things we found is that we have practices who take the training but don't ever implement. For some reason, either it's overwhelming or I just don't know how I'm going to get that done and add it to everything else. And so what we're here to do is to help you do that and help you begin this process. I brought a few of these with me. If you're interested in having them, I'm more than happy to give them. They're also included on the website, so you can download it and print it yourself and we're happy to come and help if we can. You get this implemented so that more kids can get these services and get this taken care of during their well visit. I always say they get that snaggle tooth, you gotta wipe it off. You know, teach mom how to do that so that, as my granddaughter did, she lost both of her front teeth and had 6 of them capped by the time she was 2.5. And never learned to bite an apple until her big teeth came in. And then she had to figure it all out. She had never learned it as a kid because she had no teeth. So it's really important to be able to do this sort of thing. And so we're here to help you and make sure that you can get that done. Questions? Okay.
I want you to know that that these services are important to all the children that you see. At this point, you are eligible for reimbursement for Medicaid children and CHP plus children, but all kids get decay. Certainly the decay rates are higher in the Medicaid population, but all children are at risk. So I encourage you to do this as a best practice implementation for all of your patients. I think that's really important. It shocks me that I can stand in front of you and tell you that the Medicaid population is ahead of the game in this one aspect, so we should embrace that, but all children get decay. So remember that. We have had conversations with private insurers about covering those services from the medical side. At this point, they're waiting for more outcomes to make that decision, but the conversation has been established. The last thing I want to share with you is that we have an external review going on at Healthcare Policy and Finance. Healthcare Policy and Finance has agreed to do that and is looking at compensation rates. And the goal of Cavity-Free at 3, or on our wish list from Santa this year, is to increase compensation for preventive services. That makes sense. That's going to save money in the end. So I know it's not a huge compensation, but we're looking to, if you are Cavity-Free at 3 trained, or if you're delivering those services, if we could enhance that compensation on a small amount, I think it's just what we need at this point.
I love the data about the Rocky Mountain youth. How easy is it to get that kind of data for your other practices?
I have it, and I'm happy to share that with you. So we are able to get that, and we get that unsolicited from Medicaid every quarter, and that's available for public consumption. We're considering, and we've asked for the ability to tie that to our website, so that as a provider you could go on and look at that data, because it is, if I have it, it's not too private. I'm way down on the totem pole. But you know, to do a data request takes a long time. But now they're actually tracking Cavity-Free at 3 services. And I have it here. I'd be happy to share it with you. It's a little technical, but it's pretty incredible, the number of services that we're able to provide.
Get a comment from Steve, and then a question here, and then in the back.
While we're on the topic of reimbursement, how many people actually do Cavity-Free? So you can maybe justify on our behalf. The reimbursement is 3 to 4 times what the actual expense is. How many other Medicaid services can you provide with the profits when you're reducing your home disability?
Thank you.
I have a question about xylitol for pregnant women. Are you pushing that in the pregnant women?
That's certainly part of our perinatal component, our perinatal presentation. Xylitol has been proven to be an effective way to reduce decay. Dennis Lewis is one of our master trainers, and he's got a lot of data, coming out of Dental Aid up in Boulder. He has provided xylitol to pregnant women as a service, and then they're measuring how many of the children after they're born, he provides free care to the children for a period of 2 years, and the reduction in the number of OR cases in that population. So
It'd be great if it was a covered OTC for Medicaid also.
that's a little bit difficult, but we are actually looking to, a part of the Cavity-Free at 3 proposal to the Medicaid folks is to get an enhanced benefit for pregnant women. I think that's where we start, because now we have very little. We have very little. Questions? Yes.
Could you go over the codes that
I have it in writing for you, but basically the codes change And the codes, this is a little preliminary information, but the ADA just changed the codes, so we're looking at a code change again in 2013. But the codes are such that the children up until the age of, from birth until the day before the 3rd birthday, the codes are D0145, which is an oral evaluation, and counseling of the primary caregiver. The education is really important. If you're going to do the fluoride varnish without the education, please don't help us, because we're spitting on a forest fire. So D0145 and D1206 is the topical application of fluoride varnish. Once the child reaches the 3rd birthday, so from the 3rd birthday till the day before the 5th birthday, the code changes just a bit. It's D1206 and a D0999. So a D0999 is a miscellaneous code because we don't have a code for that age population, but Medicaid has allowed medical providers to bill under that D0999. That's the code that's going to change, but you'll all get a bulletin, and if you've ever been trained in cavity-free at 3, you probably get 10 emails informing you of that code change. I have that in writing. I have it on a brochure. I'll hand it out to you. Anyone else who needs that to take back to their office, we're happy to do that. And remember, those 2 codes have to be billed in conjunction with a well-child visit.
The other thing, remember, is that kids still have their dental benefit. So hopefully they're getting that same sort of care in the dentist that they're getting with you. And when they're tiny, they're probably seeing you more times than they would be seeing the dentist. So, and as they move forward, that's why it stops at 5.
And that benefit is limited to 3 times in a year. It's not a calendar year, so 3 times in a 12-month period. So if you're seeing that patient at 1 year and you're doing a fluoride varnish and you refer them to a dentist and they go to the dental provider does another fluoride application, and then they come back to you for another well-child visit, someone help me, 15 months, 18 months? 18 months? You can do a second fluoride varnish, but then hopefully a year has passed. It's limited to 3 times in a year. It's 3 times in a year. So dental providers, we get this bright idea that if the child is extreme risk, we can do a fluoride varnish on Monday, Tuesday, and Wednesday. I don't advocate that, but there are providers that will do 3 fluoride varnish applications in a period of 2 weeks. I like to spread it out, share the love.
Nancy and then TJ?
Nancy.
Are there other metrics that you track that you would consider success in the primary care setting related to oral health, like maybe education that you should do?
I think the delivery of cavity-free at 3 services, I like to think that we're all delivering high quality education and fluoride varnish. So that's my measure of success, because decay rates are a little bit difficult. We're talking about behavior change, so it's a little bit difficult, but it's a place to start. So I like to measure, number 1, how many kits we're selling in Colorado. That's a huge number, 40,000 kits. And then really how many of the services are delivered. We are looking at decay rates in that one population at Denver Health, but I can tell you, and tied to the website, is the fact that decay rates in Colorado have come down. Have come down significantly. Question in the back.
You know, I watched the video of Dr. Deutschman's, the girl with the head on the lap, and that looks all perfect, but in reality, that's like a quarter of the time. I did it a couple times a day. It's more like crying the mouth open and fighting you. I mean, even if you have the kid, I don't know, you got any tips for that?
My first time that I went over to the child health clinic at Children's, I walked in and I had been providing dental services for a long time. My first thought was, they're all crying. Why are they all crying? I couldn't get over that. So it was the same thing. Practice makes perfect. It shouldn't take very long. Parental control of the child is key. We're talking about a knee-to-knee exam. So the child sits in the mom or the primary care provider's lap facing the parent. Knees touch between the provider and the parent, and the child's head winds up in the provider's lap. Mom has to hold those hands. Mom has to hold the hands. And Mark's child was very cooperative in that video, so it's not, I know it's not always that way, but we're happy to come out and do some practice coaching. We're really very close to partnering with the CCHAP folks to go out and deliver this practice coaching. So you get cavity-free at 3 services, you're starting to deliver, you're getting all this compensation, you say, oh, this is wonderful. Then you come into the bumps about, oh, we forgot to do it, we have the best practice implementation guide to help you, and we're willing to come out and go over some of those issues with you. I've got a great trick I can share with you. In the kit, the child toothbrush has a rubber handle. We call that a mouth prop in dentistry. So if you actually, it's rubber, it's soft, it doesn't hurt the child, but if you can get it in there, it holds the child open so that you can take a look. I'm not a believer in that, cranking it open, but this is a very effective tool to save your fingers.